feel like a singer who's coming on stage after Frank Sinatra. So I want to talk with you a little bit about secondary consequence of all of this drinking that we've been talking about so far, and especially among childbearing age populations. And I believe it's really a human rights tragedy. I just came back from Minnesota where I spoke. I did grand rounds at University of Minnesota, and I also spoke at the Minnesota Organization on Fetal Alcohol Syndrome's annual conference, and really want to impress upon you the fact that we are immersing our babies silently within the womb to alcohol with the beer that we drink and the wine and the liquor. This is actually the cover of a book that I have that's coming out this next year. It'll be self-published through lulu.com for any of you that want to get it. Just trying to figure out how to use the little clicker. The name of the book is going to be The Silent Epidemic, A Child Psychiatrist's Journey to Death Row. And I'm not going to talk to you about my forensic research and my forensic work. And I'm also not going to speak much about the clinical work, other than touching a little bit on DSM-5. What I'd like to really share with you is the need to translate the research over 40 years that have been done in animals and also in people to clinical trials and clinical work, which will make a lasting difference. So this problem, now known as the fetal alcohol spectrum disorder, has been endemic in populations for eons, as long as we've been drinking alcohol. And actually back in the 1750s, there was a gin epidemic in Europe, and probably a fetal alcohol spectrum disorder epidemic at that time. Just like with bubonic plague and other kinds of illnesses, you get an endemic level in a population, and then you get an epidemic level when many more people have it. And actually, if you notice this etching that was done of Gin Lane and Beer Alley, what you find is at the center of the picture is a prostitute who has her baby falling into a stairwell because she's so inebriated, taking a dip of snuff, that she doesn't recognize her baby is falling to its death. And this is something that we commonly see in our newspapers, women sticking their babies instead of the baby's bottle into the microwave. In their inebriated state, they're sticking the babies in the microwave. And we have essentially thrown out the baby with the proverbial fire water. So it's not something new. We've continued to rediscover and rediscover this problem for eons. I think we're enlightened enough to stop it. But this is the public health warning is an international journal article showing that babies born to intemperate families, meaning those that did consume alcohol, compared to temperate families that did not, had more babies that were born with St. Vitus dance, which is actually, and I'm probably not pronouncing it right, but it's chorea. It's chloroform movements. And so today we would know that more as cerebral palsy. Some born idiotic, deformed, dwarfed, epileptic, and then less normal. But they knew this is all the way back 1878 to 79 in a study from Bern, Switzerland. And again, all over the world they were sharing information in the late 18 to early 1900s about this, leading up to, believe it or not, Prohibition. So a lot of the Prohibition movement was actually based on public health warnings. And then right about the time that Prohibition ended, so in 1932, the year before Prohibition ended, the book Brave New World came out. Anybody read it? Okay, so it wasn't on my reading list in the humanities curriculum in my little podunk home, town of North Carolina, but I did go back and read it after hearing Ken Jones talk about it. He's the guy who wrote the first paper on FAS back in 1973. Because in the book, as you remember, Aldous Huxley, the author, created this, various different social classes of people. And how he was able to do that is at very low levels in the flasks of these babies, and this is 1932, that he developed in vitro in flasks, he would put a chemical in the flasks. What do you think the chemical was? Alcohol. You better believe it. And every now and then he would dose a little bit of X-rays just to beef up the mutations. And those populations became the deltas and gammas, whereas the alphas and the betas were embryos selected from women that were tall and beautiful, and men too, and they became the leaders of the society. And the people who were exposed to alcohol became the worker bees. So in my mind, prohibition was in a way our attempt to prevent FASD. Okay? It's not talked about much these days because it took another 40 years from prohibition in 1933, the repeal of prohibition, until 1973, when the first paper on the topic in this country was written. Now, in 1968, another author had written a paper about this in France, where you're going to see, again, epidemic numbers of these children. But I'm not going to focus on the face here. I'm going to focus on a little known fact, and this is the dirty little secret of this problem. And that is that we have the fetal alcohol syndrome at the tip of the iceberg at the top, and these are the kids that we can actually identify. But then we have a whole bunch of other kids that have a range of neurodevelopmental problems that now we know in DSM-5 we have nomenclature for it. Is neurodevelopmental disorder associated with prenatal alcohol exposure. Okay? And this right here, any of the kids who have any degree of FAS, FASD, this is the alphabet soup, and this is the stone soup. This is what we need to keep forever, ingrained in our psyches. That alcohol, prenatal alcohol, causes neurodevelopmental disorders. Okay? And that's my main point. And I take you to the research done by my mentor at UNC Chapel Hill, although I never did animal research with her, and actually I was accepted at Duke to do a PhD. Nobody knows this. I only lasted 6 weeks because they were asking me to dissect out little baby embryos from the moms because we were studying retinoic acid. And I just could not do it, so I had to leave that, and I went back to Burroughs Wellcome where I was working, and then eventually to public health school, and then to medical school. So Dr. Bernard didn't know that about me, but my journey also includes not being able to take animal research. However, Kathy Sulik has dedicated much of her career since 1981, when her first research was published in the journal Science. And I was so empowered when I found out about her research back in 1993. I had started public health school after reading a book called The Broken Cord, left my job in the pharmaceutical industry, and I met up with Kathy Sulik, and I said, why did I not know that? I graduated magna cum laude from NC State University. Why did nobody teach me what she knows? And I'm going to tell you what it is. It's that with her model in animals, she had dosed them with the equivalent of 4 to 5 servings of alcohol, timed in the late 3rd to early 4th week of gestation. And what she showed, now again, late 3rd to early 4th week, right? What she showed is that that's enough to cause the full-blown fetal alcohol syndrome. And why that is that midline defects happen. So midline defects of the face and the developing nervous system because of apoptosis that goes on in the cells. And this is one of the things that science had elicited all the way back then, but is continuing to, people are continuing to understand it. And she showed this all the way back in 1981. It was such an important finding that it was published in the journal Science. But here we are, how many years later? I'm not great at math. 1981 to current, 33 years. She's getting ready to retire. And I said, you're not done yet. We just came back from the American Academy of Child Mental Illness and Psychiatry. And I said, you got to stay with me, Kathy. I got to get you the Nobel Prize. Because although her work mainly has been in mice, she's also looked at a number of human embryos. And she's shown that things like anencephaly and spina bifida and things that we know are commonly endemic in the population at a certain level, to some extent, those problems can be caused by prenatal alcohol. So why is this such a big deal? Well, it's because that over 50% of pregnancies are unplanned. And as you've already heard, we have epidemic rates of binge drinking. College women, high school women, childbearing age women. And why is this a problem? Well, with development, it's really before you know you're pregnant that a majority of these problems happen. So, neurulation happens. Did I miss my period? Not sure. It's not really that regular because I consume heavy amounts of alcohol, which is an endocrine disruptor. It's a kind of like an environmental estrogen. Can cause breast cancer, all right? So she's missed her period maybe. And then, yikes! She finds out at 2 months she has missed it. But guess what? Fetal period is almost ready to begin. The embryo is already developed. And you have a number of women who are very educated, very, high dollar clients, so to speak, bringing their children to me and to other psychiatrists. Do you think those psychiatrists, other than me, ever ask about alcohol? I do. It's on my screening questionnaire. Is this a planned or missed timed pregnancy? At what point did you find out you were pregnant? What was your alcohol and other drug use, tobacco, all of those things prior to pregnancy recognition? Was there a chance that the child was prenatally exposed before you found out you're pregnant? Guess what? 2 women recently, because I'm only taking prenatal alcohol exposure now in my population, in my clinic, my home office, not really clinic. One woman is a researcher at NIH, PhD, and married to a physician because they had an unplanned pregnancy. She was drinking 2 drinks a day. On an average day, she said it was American Heart Association guidelines. She's Asian. Her alcohol dehydrogenase is lower and different. Okay, and guess what? Her son has the full fetal alcohol syndrome. He's now in 10th grade, really struggling. Okay, this is an NIH researcher. Do you think she intended to do that? She's from China. No. All right, the other patient I've recently had come into my practice is a very beautiful African-American woman psychologist. She's a master's level psychologist. And similar thing in her case, although it was her 5th pregnancy, very lovely family, affluent, but it was her 5th. And she's like, can I do this again? And she got a little bit depressed. Her husband had just lost his job, and she decided to finish that bottle of alcohol that she had. She had a bottle of wine. She finished it off. And her son has a lot of problems. So is it just alcohol? It's also genetic, but it's happening, a lot of it, before we know we're pregnant. And what these midline defects do then in the brain is it causes things like, now this is a normal brain. This is a brain, all of these have been exposed to moderate to heavy amounts of alcohol, but this happens very early. So this individual, as you can see, the corpus callosum, the midline area of the brain, the bundle of neurons that connect the 2 hemispheres, is a little bit misshapen. Now, I've seen an individual just like this on death row in Pennsylvania. I do these, I get MRIs of the people. Now, I've only seen maybe 12 total death penalty cases. I have a colleague who's seen over 70 that have some degree of FASD. Now, these are more severe cases, as you can see. This is holoprosencephaly that can be caused by the fetal alcohol syndrome, or fetal alcohol exposure. And actually, this would be really heavy exposures early on that are causing these. Now, those brain problems translate then into a variety of functional deficits for children, which now we have a code for in DSM-5. For the first time, we have a code. And really, you have to put it up under specified other neurodevelopmental disorder, but it's the only disorder listed. It's the only example. And many people are pointing to the back and saying, okay, we have the criteria in the back, we do need to study these more, and that is true. But really, we do have a code, so people should start using the code and start counting the kids and seeing if these criteria in the back really make sense. So prevalence-wise, we know that fetal alcohol spectrum disorder is probably as common as disorders that we're all concerned about: Down syndrome, spina bifida, cerebral palsy. The CDC estimates that 1 in 20 school-age children have some degree of this problem. 1 in 20, that's a huge number. And if you look at autism, the rates are much lower. Cerebral palsy, Down syndrome, spina bifida. Now again, if you consider 40,000 babies per year are born with this preventable condition, 40,000, comparing it to this, it's an epidemic. So why should we be concerned about this? So what if a certain number of the population ends up with mental problems, intellectual disability, and that kind of thing? It's because these problems, combined with witnessing or experiencing abuse, end up creating situations where the child becomes violent and delinquent, okay? And this is a major problem. It's not just this problem. This was actually my master's thesis, how I laid it out in 1993 to 95. I mean, this stuff has been around for years, and it's written all up in the criminology journals. They're just not connecting it to prenatal alcohol. And why this is such a big problem in my mind is that it's an endemic problem in the underclass. And if you look at the people who are unemployed in part-time menial jobs or receiving public assistance, this is where the condition stays at a relatively low rate most of the time. But then when middle class and upper middle class, I'm talking college-bound, college-age women are drinking and they continue their drinking behaviors into adulthood, they're the ones who are going to, have this problem happen to them. So it's a big financial problem in our country, $5.4 billion just for FAS alone annually. And this was all the way back in 2003 that this study came out, so it's bound to be a lot higher. And what are we doing about it? Well, we're putting $30 million annually on the topic with NIAAA funding. Now, CDC does a lot of prevention stuff, and they're moving more toward a preconceptional approach and teaching people about contraception and things like that, which I advocate for. But why is it that $17 million is still being spent on animals when we don't have that research translated for human knowledge? How many people do you think know that it's the late 3rd to early 4th week of pregnancy that a majority of these problems start to happen? Not many. Now, I want to go back to that figure, 30 million. I'm from Montgomery County. I'm not originally from there, but I live in Montgomery County where NIAAA is based. Our annual income in the county, because we regulate our own sales of alcohol, $30 million a year. And I know this because I sat on the Alcohol and Other Drug Advisory Council for the county under our county commissioner, and I only could stand the politics for 18 months, but it was enough to learn a lot of facts. And this is a big problem. Our annual budget for FASD is equivalent to one county's income for alcohol. So what do we need to do? You heard already about some gaps in research. I think for FASD, we really need to identify what genetic factors predispose babies to this problem and mothers to this problem, and find a biomarker for identifying the children once they are born so that they can get specialized treatment services. We also need to be questioning women a little bit more sensitively about their use and not blaming them. And then providing, just like we do for autism, early intervention. But the interventions that work for these kids are going to be a little bit different, okay, than for Down syndrome or autism or other problems. Now, in my view, it's these early intervention studies that we really need to hammer home and we really need to do more about. And as a clinician, pharmaceutical clinical trials in this population really needs to happen because many of these kids have genetic differences from having been prenatally exposed, probably epigenetic differences that lead to differences in their side effect profiles for some of the medications. And it's very hard to find a child who has this degree of condition, who has FASD, who are on fewer than 3 or 4 psychiatric medicines, and that's a big problem. And then practice parameters, uniform treatment protocols, all of these things, doing evaluation studies of community-based strategic planning programs. Those are all important, and I feel like if you look at NIAAA's their webpage, it says they sponsor projects on prevention treatment of women with alcohol use disorders, improving diagnosis of FASD, increasing understanding of the effects of alcohol on the unborn child, and developing effective interventions to mitigate the health effects of those prenatally exposed. Where's the animal in here that relates back to this 17 million? Where is that? So just to end, I want to tell you, my big push now is to get people to understand that the warning label is not right. So can anybody in the room tell me what's wrong with the warning label on alcohol? All right, I'll give you a clue.
It talks about, sorry.
Yeah, go ahead. Yeah, please.
Well, I had dinner with you last night. So.
Yeah. Well,
it
you
talks about drinking during pregnancy, not necessarily drinking when you're kind of a child or essential or trying to get pregnant.
Yeah, during pregnancy. That's
and
the
also,
big,
from a communication point of view, these are very small, fine prints. I'd rather have something like, like smoking warning label where you can see a lot more graphic.
Yeah, so in other countries, that's what they're doing. They're putting a huge no sign with a pregnant woman, but it's an already pregnant woman that's on the label, but at least it's got that, kind of black box warning, so to speak. So in my view, it should say, if you use alcohol, avoid pregnancy, that is contracept, or if you don't believe in contraception, cross your legs. And if you're pregnant or planning a pregnancy, avoid alcohol, okay? And that is the gist of our Better Safe Than Sorry project, which does focus mainly on childbearing age populations, college age girls. I had 8 interns working with me this summer. I believe in what you said about incorporating the youth into what you're doing in your study design. You're here in Maryland. I have Master of Public Health. I think we could, talk about designing a program. But we have a campaign that's a blog, and we upload things to the blog that are written by teens and by college people. We passed out this year for FASD Awareness Day condoms at a bar in Bethesda, the Barking Dog, and those are out there with my contact information on it. And unfortunately, they're all extra large, so you'll just have to anyway just set them up to the side. But thank you so much for your attention.